The Komfanochi Teaching Hospital is recording an upsurge of COVID-19 cases among children. In the last 10 days, the facility has recorded 9 child cases, including an 11-day-old baby. Head of the Child Health Directorate, Professor Samson Enchi, says the situation is taking a toll on the facility as management struggles to access space for children diagnosed with COVID-19 and other cases.
The Komfanochi Teaching Hospital is the only pediatric referral facility in the northern sector of the country. Like other health facilities, the hospital is overwhelmed by the number of COVID-19 cases involving children. At least 9 cases have been recorded in the last 10 days. Head of the Child Health Directorate, Professor Samson Enchi, says the situation has put a strain on the hospital.
We are having a huge surge in COVID-positive cases. The disease initially, children were said to be spared. We have 14 of last year. But this year, just in a space of 10 days, we got 9 positive cases, children. And our HIU, remember, our main pediatric HIU is 3 bed. That is full. MBU is 1 bed. That is full. And so it's so happening that some 2 other positive. Other 2 are well, they've been discharged. 1 person died, have been discharged. And so we had another 2, but we had to keep them at the holding area. The COVID strain that we are having now is really also affecting children, seriously, because in the first of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we are going to go. And we are already full. And so that is what we are saying, that everybody must help.
Management says the hospital is overstretched and it is in dire need of space. Professor Enchi says the facility can no longer admit pediatric cases. He says there are ongoing talks with the Regional Health Directorate to create a treatment center for children with COVID-19.
As it is now, we are not in the position even to bring new cases. I don't mean COVID. Anybody who is sick, if you come here, we will just drag you in front, rubbing an ambulance that you came with. If there's something we need to do for you, we can do to stabilize you, then we send you back. Because our wards are full, we are exploring the possibility of getting treatment center for children. As far as I'm concerned, we haven't got a place for children. And just Monday, we were in talks with the medical director to actually talk with them. I think he also had discussion with the regional health directory to see if they can create space for children who are stable, COVID positive who are stable, so that we can move some of them there, so that we can get space.
Medical Director of the Komfanochi Teaching Hospital, Professor Bafo Kofi-Poku, says out of 504 samples taken, 251, representing 49.8%, returned positive.
At the end of yesterday, which is the 26th day of January, we have tested 504 patients, out of which 251 are positive, 49.8%. Almost 50% of all patients who have come here and have been tested have been found to be positive. So it is the duty of us, and together with you, the press, to drum home to the public about the need for us to take the preventive measures seriously.
Meanwhile, management has denied allegations of neglect and lapses in its COVID-19 management. Some caregivers at the Child Health Directorate have accused management of putting their lives at risk as suspected COVID-19 cases are managed alongside other patients. But at a press briefing to respond to the allegations, management denied the allegations. From Kumasi, for JoyNews, Ohimene reporting.
Ohimene's reports there. Meanwhile, the alarming rate of pediatric COVID cases, of course, is taking a toll even on those who work there. Let's go to Ohimene, who is joining me via Zoom. Hello, Ohimene. Hello, Ohimene.
Now the video tool.
We'll be getting through to Ohimene to find out from him. We understand that there have been a number of deaths. Let's clarify this with Ohimene. How many of those deaths occurred in just this year? Hello, Ohimene. Can you hear me?
Yes, Gifty, I can hear you.
Great. So, Ohime, help us understand, clarify the issue concerning the deaths. I think about last year, we know that some 4 of the children died to COVID-19. Help me clarify this.
Yes, Gifty, is the same question that I asked the head of the Child Health Directorate, Professor Samson Entry, at the Confanoche Teaching Hospital yesterday, and he couldn't put a figure to the number of deaths that have been recorded at the facility, but he indeed confirmed there have been some deaths involving children at the Confanoche Teaching Hospital since last year. And when we started working on this particular story, where health care providers and doctors and nurses accused management of failing to protect them in the management of COVID-19, it came up that one of the 9 children who suffered or who contracted COVID-19 recently has passed away. And when I spoke to the head of Child Health Directorate, he says he wouldn't want to be misquoted, so he wanted to get the figures right. But he indeed said some of the children have died.
So we know for a fact that some of the children have died, and it is from COVID. What we don't know is the number. Ohime, is this correct?
Yes, this is correct. But just this afternoon, my attention was drawn to an interview that Professor Samson Entry had on a local radio station in Kumasi, and he revealed that 3 children have died since last year. So taking into consideration what he told me yesterday and what my investigations revealed, that these 3, one could be from the 9 that have been recorded, and then 2 last year. So that is probably what might have happened, Gifty.
Well, Ohime, you've been speaking to some authorities there. Let's listen to Ohime's conversation with them, and we'll go back to Ohime afterwards.
Pediatric COVID-19 cases as at the end of 2020. But the facility has recorded 9 positive cases in the last 10 days. The child cases were among 504 samples taken at the facility. After testing, 251 tested positive, representing 49.8%. Doctors at KATH are disturbed at the infection rate among children. Head of Child Health Directorate, Professor Samson Entry, says further investigations need to be conducted.
We are having a huge surge in COVID-positive cases. The disease initially, children were said to be spared. We have 14 of last year. But this year, just in a space of 10 days, we got 9 positive cases. Children. The COVID strain that we are having now is really also affecting children, seriously, because in the course of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we are going to go, and we are already full. And so that is what we are saying, that everybody must help.
Professor Entry says, though earlier studies suggest children were spared of COVID-19, the trend has changed.
People are talking about the fact that probably the strain, I don't know whether clinical cases that we are testing belong to the new strain. What I know is that they said that those tested at the airport coming from have shown the new strain. We don't know whether they've actually gotten into the community. It appears to be more virulent. Virulent means that infectious. It means the ability to infect somebody is higher than the previous one. And that is why children, naturally, we think that because children are exposed to a lot of KATH viruses. Coronavirus is like a KATH virus, actually. What the science tells us is that there's a cross antibody reaction. Some antibodies to normal coronavirus that children get are able to neutralize the COVID. And that is why children were a bit spared. That is what the science is. Now, we don't know. I think that we need to probably do more research and find out whether this new strain is different. Probably the KATH antibody that children get that was able to protect them somehow is not able to do the same for this current strain. So we are alarming. I'm saying that just within 10 days we got 9. And so really we don't know where you're going to go.
Meanwhile, the Komfanoche Teaching Hospital says it can no longer admit more patients as its wards are full. Officials have appealed for COVID-19 treatment center for children. From Kumasi, for Joy News, Ohime Nteria reporting.
So that's an update or an updated version of the report we played to you earlier that Ohime filed. So as it stands now, the authorities at the Komfanoche Teaching Hospital are looking to understand what it looks to them like a different strain or a different variant of the virus that we're dealing with. Mind you, on a national, at the national level, there are discussions that we have identified certain different strains which we're still studying to substantiate. Ohime, let me just engage you briefly before we go on with the next matter, which I'll still engage you on again. The authorities at Komfanoche Hospital seem to be alarmed, and they are talking about it. But do the people themselves who are going there, 50% of whom are testing positive, according to the doctor, aware of the situation, and are they responding correctly to it?
It's a bit difficult to speak to people what they make of the situation at Komfanoche. Responses as to how people are reacting the issues at Komfanoche, but how people react to the management of COVID-19 and how they should adhere strictly to protocols as outlined by the Ministry of Health as far as COVID-19 is concerned. Even at the facility, we are told, according to the medical director, Professor Bafo Kofi Poku, he says there are instances where parents or relatives of patients who come to the facility, especially I'm referring to the Child Health Directorate, they come and when you ask them to put on their face mask, they renege in doing so. And there are also instances where even health professionals and nurses will also, renege in putting on the face mask. And there are also instances where these nurses, though they may be in face mask, will sit down unconcerned as they watch some of these patients' relatives flout these COVID-19 protocols. So to the people outside the hospital, they seem not to care so much about the developments and happenings at Komfanoche, to the extent that some have also chosen to use Komfanoche as a thoroughfare. Those who travel from, say, Bantama to the central business district of Edum prefer to use Komfanoche as a thoroughfare to avoid, falling into heavy vehicular traffic. But the hospital management have on several occasions warned that because of the precarious situation at Komfanoche, where people who go to the facility continue to test positive for COVID-19, and the virus is also airborne, they expect that people will be aware of this danger ahead of them and not use the premises of Komfanoche as a thoroughfare. But still, you still have people who flout these warnings. As of yesterday, the arrangement from hospital authorities after a management meeting was that now they are going to restrict the number of visitors who patronize the facility. So if a patient is on admission at the facility as of now, the only thing they can do is to allow one visitor a day. And that is the arrangement they have introduced. And they say it's because of the upsurge in COVID-19 cases. And so, I must say, yes, the situation at Komfanoche is a bit dire, because when you look through the statistics as provided by the medical director, since last quarter, between last quarter and this year, as at January 26, 504 samples which were taken, 251 returned positive. This represents 49.8%. So it is an indication that indeed COVID-19 is real and very present at the presence of Komfanoche Teaching Hospital.
Well, Ohime, hang on for me right now. Let's talk about the Ghana Medical Association. Their General Secretary says a lot of hospitals are under stress and immediate measures ought to be taken to support the country's health systems before the system crashes.
I mean, this statistics say that this is a small research, in quotes, and this is at a community level. People within Kumasi, Ashanti region, basically go to Konfanoche, and a small sample size gives you 50% return in terms of positive results. It tells you that we have significant community spread. I agree that the sample size may not be too huge, but if you look at the trend, it also mirrors what is happening within the national space, where our figures were down, let's say, between September till now. You can see a progressive rise, but in January, the rise is very steep. So clearly, we have a big problem on our hands by way of the COVID infections in the country. The second bit has to do, listening to him, has to do with the difficulties that the health facilities are facing and the fact that clearly they are overstretched. You can see how, per the report, they are struggling to handle COVID patients, specifically when it comes to kids. You could see the problems in there as he described or gave us a vivid account of what is happening. And then issues relating to infection prevention control and the fact that hospital-acquired infections may also be going on, all as a result of the fact that we don't have enough facilities to manage COVID. So the problems are there. The society itself also doesn't seem to be listening to a large extent, because it tells you that people come into the health facilities and they don't even have masks on. They are not masked up. Meanwhile, last year at some point, it was so clear that without a mask, you cannot even enter the hospital. You will be turned away. So clearly, we have a challenge on our hand, and we will need to take some very drastic measures now to help keep the situation. Where we are heading, it doesn't look good for us. That is the obvious truth. We need to act and act now, because on a daily basis, the problems keep compounding, the issues are being brought to the fore, and that is it. This is Konfanoche. It's the second biggest hospital in the country, and you see the problems there. Technically speaking, the biggest hospital, Kolebu, is no different in terms of the problem.
It's scary.
Fast forward it to the regions that don't even have the facilities and the human resource to start with. That creates a huge problem, especially when it comes to the specialized units like the HDUs, the ICUs, where you need specialized professionals in terms of practice to take care of the situation. So the health system clearly is overstretched. And one thing that we all have to understand and we all need to do quickly is that we need to go back to the measures that were put in place at the various health facilities some months back, where the OPDs were technically speaking regulated in terms of numbers, where some chronic patients could not really come in as it is. We were managing them via, e-health, mechanisms, i.e. video conferencing, phone calls, stuff like that, telemedicine, that kind of thing, where community pharmacists were interacting with doctors to help ensure that some of these patients can get their refills. That will reduce the numbers coming in.
That's the General Secretary of the Ghana Medical Association you heard there. Ohime, are you still there?
Yes, I'm here, Gifty.
All right, Ohime, I just want you to hang on, because there are still concerns that the GMA is raising. They're also calling for investigations into growing resentment among caregivers, also at the Konfanoche Teaching Hospital, over the management of COVID-19 cases there. The caregivers, especially at the Child Health Directorate, say the poor management of COVID-19 positive cases puts their lives and that of other patients at risk. And the Ghana Medical Association also says that the issues raised by the medical staff should not be treated lightly. Ohime will give us more on it, but take a look first.
Some doctors and nurses at the Child Health Directorate of the Konfanoche Teaching Hospital have revealed there is no concerted effort by management to either test staff who come into contact with COVID-19 positive cases or close down wards for fumigation. A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She insists medical staff who voice out their concerns could become targets and victimized.
We know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward. Because as we are being told, there is currently no trained personnel and no specific place to keep those patients. So they were being managed on the ward. In the first place, we don't even have social distancing on the ward because the wards are full. We had to manage these patients side by side with the average normal sick patients.
The Ghana Medical Association says the issues raised by the caregivers borders on life and death and should not be glossed over. Dr. Pakwesi Bedu is the Ashanti Regional Chairman of the GMA.
Any issue that borders on threats of life is very serious. And we've seen that now with the new strain or the second wave is killing people. And per your report, even kids now, somebody less than 1 year is getting it. So nobody is immune. So in a case that threatens the life of any health worker should be looked at and shouldn't be swept out of the condition. And as you rightly said, from here, we'll be talking to management. Luckily, we're also going to find out what really happened.
Dr. Bedu spoke against victimization and encouraged medical personnel, especially doctors and nurses, to voice out their concerns through leadership for redress.
We've been talking about this culture of silence within our hospitals, the various hospitals. And we think if we keep sweeping these issues, when next time something like this arises, nobody will mention it. But then it kills the morale. And you realize that people go to work, they are so scared of what they will come into contact. And when they contract something or they see something, they are scared to. It kills the morale. And by extension, because if the health worker is not happy, we tend to displace that unhappiness onto the patient, which shouldn't happen. But it's a human institution. So you find most of us being rude. Some of these things stem from when concerns are raised and they are not addressed adequately. It brings about these agitations. Victimization is real. Unfortunately, we have turned most of the hospitals into an extension of our political parties. I never heard of party associations within hospitals, but here it's so prevalent. And so if there is something going on and I raise it that maybe, or this issue is happening, ABCD, and I think we have to address it. The first response is, you are against us, you'll be tagged.
Management of Konvanochi Teaching Hospital is yet to respond to the concerns of the workers. From Kumasi, for JoyNews, Ohime Interior reporting.
So, Ohime, at the time you filed this report, there hadn't been a response. Has there been any so far?
Yes, management of the Konvanochi Teaching Hospital has responded to the allegations raised by the workers and dismissed most of the allegations. But listening to the explanation that they give, you could at a point feel that indeed some of the issues raised by the agitated workers were indeed true. We can take a listen to the head of the Child Health Directorate, Professor Samson Enchi.
It is not true, as I heard from the news item on Monday. I heard it on JoyNews, that we haven't gotten a standing team that handles COVID cases. That is not true. It cannot be. And of course, if you have a standing team, it means they are trained. And you see, we are doctors, we are nurses, we are health professionals. A case you may see, you think not COVID, will turn out to be COVID, and we are taking care of this. And so the idea was those who were trained at the COVID team to train everybody, every staff. And so everybody has been staffed for you to also suspect. And if they need be, you can also support treatment of cases. So by this, we cannot actually mix children who test positive with those who are not suspected cases. But you should expect that sometimes somebody will come, you screen, he didn't fit into a suspected case, and then he's admitted to the wards or any other place, not in the holding area. In the course of time, he may develop symptoms that you review that would then suspect COVID. What will you do? Definitely, that person will need to be put in the holding area, and then you test, then it's positive. So in a scenario like that, a staff who is handling a particular group of patients in a ward, a child later is suspected after he's passed through the screening to have COVID, and the person tests positive, then that one constitutes missing cases with this. We cannot do that. We can't put the life of other children at risk, and can't put our own staff life also at risk.
So, I mean, that's the explanation being given by authorities there. Have you had a reaction on the back of this explanation from those who are being complaining?
For the caregivers, they believe that this particular response from management is indeed confirmation to the earlier concerns that they raised. For instance, Professor NP says there are instances where a patient who report at the facility could go through screening, and later probably he will not show signs or symptoms of COVID-19, but later will show the signs and symptoms. This comes to the allegations that indeed when this person shows symptoms at the wards, he still be lying and mingling with other patients who are not COVID-19 positive. So by the time they get the results and try to move this patient from the ward to a side ward or probably to the demarcated treatment center, then it means this person may have mingled with the negative cases. And then again, the caregivers also mentioned the lack of social distancing at the wards. Management also indeed said it would be difficult to manage social distancing at the wards. And they also mentioned the fact that there are instances where they don't get appropriate PPE. The word that they use is appropriate PPE, but management says they've been giving these caregivers a PPE, but the concerns of the caregivers or the doctors and nurses is that they don't have the appropriate PPE. So all these responses, if you sum them up and compare to what these doctors and nurses said, then it means that the management of Kofi Annan Teaching Hospital has a long way to go in ensuring that they provide ultimate care to both the general public and this staff. So for the doctors and nurses, they say they'll continue to do their best, even put their lives on the line to save others. But then they expect management to also come to their aid, give them the appropriate materials, appropriate equipments that they are needed to work with at the facility.
Ahime, thank you very much. This obviously is a developing story, something we'll certainly keep following until there is some level of consensus. Ahime, thank you very much for that update. Ahime Interior is in our sister station in Kumasi, Love FM. They're bringing us up to speed on the situation at the Kofi Annan